saying, having a baby changes everything in your life, both physically and mentally. And many moms experience unexplained sadness, anxiety. Sometimes it's more than just baby blues.
Studies show that 1 in 7 women may experience postpartum depression in the year after giving birth, and actual numbers may be higher since many women don't seek treatment or even recognize what they're going through. So how can you recognize the signs in yourself or in a loved one to help them? News 6 morning anchor and health reporter Kirsten O'Connor is standing by to ask a doctor.
So the anxiety we're talking about isn't just about being unsure as a new mom. In many cases, it can really take a toll, and in some others, it may be much less extreme. So Orlando Health OBGYN Dr. Christine Greves joins me now to help us learn about what's normal and what's something that you should maybe point out to your doctor. So first of all, for new mothers out there who hear about postpartum depression, are there signs when you're pregnant that you may actually experience this after you have your baby?
And that's a great question. I would say, pregnancy is difficult, and it is difficult to decide, what is depression, what is not, et cetera. So I would say that if they're noticing changes in the way that they're feeling, difficulty sleeping, starting to have sadness, anxiety, just not feeling like themselves, if they have a history of depression, things like that, then I would tell them that could be a little sign that they need to mention it to their doctor, so that way we can get you on board with trying to be on the right path to help if those symptoms do occur.
And that leads us to thinking about loved ones and all the people that are around a pregnant woman at the time that you hope are there as a support system.
Yes.
Is it the responsibility maybe of a partner or those loved ones to kind of check in mentally with a mother?
Yeah, it would really help if their partner or their loved ones would say to them, hey, let's have you go talk to your doctor a little bit more if you're not acting like yourself. Like, for example, there are different extremes. Like, there could be, from the moment of going through the grocery store and wondering, should I buy this brand or this brand for my baby, what's better? And inability to make a decision because you're so anxious, versus, the severe side effects that we see sometimes.
And so that is normal, though. You see that a lot with new mothers and even mothers, second, third children going through those difficulties with decisions.
Yes.
So that's not something that mothers should worry about.
Oh, no, not worrying about that. But like, if that's just one of the many things, difficulty sleeping, eating, concentrating, just really signs of depression that persist for more than 2 weeks.
As a partner or a loved one who starts to notice these symptoms, what's a good way to approach a new mother and say it to them in a way that, doesn't come across as, I think you have a problem, more as, I think we should go do this together and talk to the doctor together.
You just said it. That's beautiful. Meaning, I think that we're having some challenges here, and it's not there's not anything wrong per se, but this is something that could be fixed. There are different things that we can do to make things better. So why don't we try to go to a professional and talk to your doctor who you've been bonding with throughout pregnancy and say, hey, what can we do to help? And then we can get you on the right track. That way it's not as much stress to the partner. But having a partner on board is so helpful because, they can help with the lack of sleep, things like that.
All the other things that go along with new motherhood. And you said, well, the ladies at the desk said 1 in 7.
Yeah.
That's a lot of women out there.
A lot of women. A lot of women, yeah. And sometimes they don't even need to say anything. Sometimes when, if they're just not feeling themselves, like, for example, if you are, not you, but if, like, whoever's listening is experiencing postpartum depression or their loved one, all you have to do is just make an appointment. And then once you sit there, just open up, and it's all confidential, and just sometimes all a woman does is cries, and then we just figure it out together.
Yeah, but it's something that you know a lot about.
Oh,
so
yeah.
Not something scary to talk to about your doctor.
No, not at all.
All right, thank you so much, Dr. Greaves,
you.
for joining us, and we'll have much more health topics to come on Wednesdays. I'll send it back to the ladies at the desk.